Welcome to It Takes Heart. I'm Kate.
And I'm Sam, and we can't wait to share more incredible stories of healthcare professionals making an impact across Australia.
Dad's not just a doctor. He's the counsellor. Yeah. He's the listening ear. He's the person that people turn to. And so that's why it's so important that we support our rural health practitioners during crisis.
Don't forget to hit follow or subscribe if you want to hear more stories from inspiring healthcare professionals.
We care for the land and sea.
So, with each episode of It Takes Heart, we are donating to a charity of the guest's choice. And in my episode in Season 1, I chose Rural Doctors Foundation. I really felt the foundation aligned with the work that we do, but we loved the fact that they work so hard to improve the health of rural communities. The rural communities has been a common theme in many of our episodes since, and we thought it would be great to better understand the work that the Rural Doctors Foundation do. So today we are joined by their CEO, Fran Avon, as well as Dr. John Buckley, who is one of the incredible GPs participating in one of their programs. And we really look forward to learning more. Welcome to the both of you to It Takes Heart.
Thank you.
Thank you.
So tell us a little bit more about the foundation and the work that you do.
Yeah, so the foundation started in 2016, and it was after the floods that decimated a lot of Queensland, and a number of rural doctors who were very passionate about the fact that communities and the doctors were left without access to healthcare, to services, and so they wanted to do something in times of crisis. And so that's how we started, and it was very much a volunteer organisation run by a number of rural doctors, and with support from the Rural Doctors Association of Queensland. And the story's been amazing because it started with that purpose, but it's grown since then, and it's very much, we're still doing our emergency work, and obviously the recent floods in Townsville, we've been helping out some GPs in the community there to provide support. But we're doing a lot more now. We're doing providing grants to people that are living in rural communities or are the health practitioners in those rural communities to get health initiatives off the ground that they may not have been able to without some seed funding or without a bit of support. And it's really great for us to see, 5-10 years later, some of those programs are, really big programs now, or, they've been able to continue because of our initial work with them. And one of them is my inspiration. It's Heart of Australia, and they, we were one of their first supporters, and I look at them now and I go, oh, we want to be like them. So it's really great. We also do research into health issues and really try and understand what's happening out there for our rural health practitioners. And we also, the program that John is a part of is very much about looking after the health of our rural health practitioners. So we're going out into rural communities with GPs to provide GP services for our rural health practitioners who people, really need independent support. But obviously John will talk about that a bit more because
the program's really interesting. I'd love to hear. So you're a general practitioner. Is the work that you're doing in this program, is that the side hustle?
No, that's my main
this
clinical work now.
This is your main clinical work now?
If this was video, you'd see my grey hair.
It is.
So, but it's been a passion of mine for a long time. I spent most of my medical career working in GP education and training, and particularly with a focus on rural training. So I've watched doctors come and go. I've watched how hard it is to recruit, and you guys know about that. Yeah. And I've watched burnout, and I've watched people leave, and I've watched the stresses they have. So when this program came up, just as I was leaving the practice I was working in, I thought that's a fantastic bit of work to do. I still do other work as well, but that's my main clinical work now, is to have this great privilege of seeing friends, colleagues, and people I've never met, and trying to sustain them in their work in the rural areas.
How do you do that?
Yeah,
what is a day in the life?
Program.
The day in the life
of your role look like?
Yeah.
How does that program?
So the program is magnificently set up, and that's how I sort of came across, is when they first announced it. And it's a goal that the idea is that we go to several towns. It's a pilot program at the moment, so I have the privilege of going to Stanthorpe, Gundawindi and St George, and my colleague John Duyere goes to 3 other towns, and we're evaluating how that goes. So on a week of a trip, I'll just head out to St George on day one, have a nice, beautiful drive. I love driving out there.
Are you based in Brisbane?
I live on little Coochiemudlo Island, just
wow.
off from the coast.
Yeah.
So I head out there, and then I'll stay overnight, and in the morning I'll pop into a generous clinic in St George and spend a fair bit of the day there seeing whoever wants to see me, and then I'll hop in my car and drive to Goondiwindi.
When you say whoever wants to see you,
yes,
is that the staff in the practice?
No,
or?
well, it's not really the staff. It's open to any health practitioner in that town or area who wants to come.
Right.
So, and it's what I really, one of the things I really love about the setup is it's completely independent. So I don't work for the Rural Doctors Foundation, and I don't work for the practices. I am my own self, and all of the records for confidentiality purpose are kept entirely separate. I don't log into the systems in the practice. No one really knows who comes except the reception staff, and even for them, I just give them a piece of paper saying, "Here are the people coming today," and they destroy it at the end of the day.
And I guess, why is that important?
It's really, I think for many people, it's important for their health anyway, that they have privacy concerns and issues. But when you're in a small town, if you've ever lived there, gossip's a terrible thing. And for most people, it's one of the reasons for the program. They can probably see a colleague about most things, but not about everything. And if there's issues of sexual health, of domestic violence, of mental health issues, they often don't want friends and colleagues and others to know. So that privacy and confidentiality that we all want for those areas of health is critical to maintain. And it's hard to share that with a colleague with whom you work in the same practice or the same town. So having someone come into town who's separate from all of that, keeping records separately, and even at the practical level, if you need a certificate for time off work, you're probably not going to ask your boss for that.
Yeah.
It's really difficult.
You just don't think about that at all.
Yeah, people don't. And what Fran mentioned, the research, and these are things we've always known, but the Rural Doctors Foundation research has highlighted that all of these things we've suspected are now true and proven, and that really helped guide the setup of the program.
Fran, you mentioned earlier about when there's a flood, and again, we think floods about houses and, people then homelessness, but we don't actually think about services, or it's probably not front of mind. And then you said we go in and we help out. What does that mean? What are the foundation? Are you sending in doctors? Are you...
And it depends upon the crisis, but in the past we have flown doctors into rural communities to be able to provide support and services at the time. For some of them it's about a hardship payment. A GP or a health practitioner, their home's been totally destroyed. And how do they get back on their feet very quickly?
Because you want to make sure they stay there.
Exactly.
Yeah.
And you want to make sure that they're there for the community, because in times of crisis, people turn to people like their GP or their nurse because they are trusted. They are the people that you want to see that it's okay. Yeah. This crisis, we're going to get through it. And that's probably one thing that I've learned in my time at Rural Doctors Foundation. The role of those sort of people in their community, it has a real weight. It's a very big burden for some of the rural health practitioners to carry, that they are always the person that people look to.
Yeah.
And one of our board directors, his father is a rural GP, and he said, Dad's not just a doctor. He's the counsellor. Yeah. He's the listening ear. He's the person that people turn to. And so that's why it's so important that we support our rural health practitioners during crisis. And so our, appeal is very much about, do we give equipment to get them up and running? Do we send in medical supplies? What is it that we need to do so that healthcare can continue? In one case, we provided funding for a GP to work out of a hotel room for telehealth. Yeah. To be able to continue serving his patients in a different way, of course, but at least he was able to make sure they had their prescriptions, make sure that they were able to continue to get healthcare, maybe not in the same way as prior to the crisis, but so it does depend on the circumstances. So it does look very different for each type of crisis that we're responding to.
And is the work that you do Queensland specific, nationwide?
We started as a Queensland charity, But, very exciting that we are now a national charity. And obviously, as John mentioned, the trial of the GPs for Rural Docs started in Queensland because that's where we've got our roots and we've got our networks. But, we're very excited that we've just received some funding that will enable us to take it outside of Queensland.
That's wonderful.
And, that's where we want to get to, that every rural community across Australia has access to the services that we provide.
Because I guess you're touching a small amount of rural communities at the moment, presumably. Maybe paint a picture for people listening of what does it typically look like? The communities that don't have access to this, are they avoiding their own health? Is there wait lists? Are they having to leave communities? Like, what's the alternative?
So when we did the research, the alternatives were, as John mentioned, they were seeing a colleague that may not be, I'm sure it's quality healthcare, but it may not be the best healthcare for an individual. They were travelling. And so they were travelling, 700 kilometres just to get their own healthcare. And that's obviously a burden on the GP or the health practitioner. But what it also means is that community is left without a GP, and that could be for up to a week. And so what that means is, there's probably 75, 150 people that don't see their GP while they're away.
Yeah.
And what we're doing with this program is making sure that they're in their community so that they're there for the community, and those appointments are there. They're available because the GP hasn't had to travel to get their own healthcare.
What other programs do you offer? Like, is there additional programs to the one that John's on? Is there any of those that you could tell us a little about?
Sure. So we're doing it in other communities. So as John mentioned, we've got Dr. John Doyer, who's doing the communities of Charleville, Quilpie, Cunnamulla. We're also looking at other communities that, we can expand the service to. And we've just had an announcement of some funding from Western Queensland PHN, which will enable us to deliver the service to Blackall and Buckalden.
Fabulous.
We've had a corporate partner come on board, and they're going to fund the service in New South Wales. Not all of New South Wales, but some of the communities in New South Wales. So really that's where we're at. And that's why at the beginning when I talked about Heart of Australia being the inspiration, Dr. Gomes, he mortgaged his house and started that program. And now you look at the program and, speaking with Ralph, he's sort of talked about how in the early days, couldn't get anyone to support the program or fund the program. And a couple of things happened that few people came on board, and then it was a bit like a snowball.
Yes.
And that's what I kept saying to the team. We've got a very small, hard-working team, and I keep saying we're still pushing that snowball up the hill, but, with these two recent rounds of funding, it's encouraging, and we just hope that this is the beginning of other people going, yeah, we really do need to look after our healthcare professionals, and we really need to make sure that they're healthy so they can look after us. And so obviously we want other partners to come on board so that we can offer this service to every rural and remote community across Australia. And a bit like Ralph, we took a leap of faith. We invested our own funding to get the program off the ground and to demonstrate its impact. And I'm sure John will share some stories, I can share some stories, but it really is having an impact, and that's so encouraging for us.
I'd love to hear. Yeah, John, could you share something with us that really shows and demonstrates that impact?
There's one GP I've seen as a patient who is one of the most respected GPs I know in rural Australia. Has been there a long time, and that GP was driving a long way, as Fran suggested, to get healthcare and trying to fit it in with family trips to the coast, and found it just didn't work. So had really been managing care by doing their own referrals or getting a corridor chat with someone, and hadn't had any coordination of their own healthcare for 15 years, which when they think about their own patient, of course, they would think is terrible.
I was just about to say, that would be so conflicting for them as well.
It's awful. And so it's not that and it's almost a bit like the American system, I'll get myself off to see this specialist and that specialist, but nobody looking after their general health or their coordination, which is what general practice is so critical. And they knew it, but they didn't feel they had an option. And suddenly this project was happening and they had an option that they wanted to try and work. And so that's an obvious thing. The other thing that's happened, the program was initially conceived to help look after doctors, and then it changed to all health professionals. And when I looked at that and went out on a reconnaissance trip and talked to people, I realised it's just as hard for a local allied health person or a local nurse, community nurse or hospital nurse to see the doctors that they work with in a small community. And so the challenge is just as strong for allied health nursing and other health practitioners. And so, again, part of the pleasure has been meeting and having a few patients who are not doctors, which is not what I expected when I joined the program. And it's actually a delight to understand their barriers and to have them relax about the confidential nature. And I know medicine's always supposed to be confidential, but it's hard to trust that in a really small community and small place. So that's been an extra bonus to see that those people have the same barriers and how important the program is.
Because I think as much as there's obviously going to be confidentiality, but you can have a conversation in a clinic room and then see them in the supermarket 10 minutes later. And there's still going to be that feeling that you have, I imagine.
It's awkward.
Yeah.
You can manage it and you can both sort of smile inwardly and think that's okay, but it's not the same. Or, your kids are at daycare together or you play tennis together and there's others there with you. And if you've got a sense of, I know something about you and they look at you, it's hard. And I lived, a few years in a very small town and, you don't get a feeling of privacy about yourself.
A real theme in some of the conversations we've had has been about the impact that the community can have on attracting healthcare professionals to these rural communities and the impact they can have not only in the attraction but the retention piece of healthcare professionals, doctors and allied nursing. Yeah. What have you seen in some communities that they're doing really well to attract and retain health professionals, or what would you love to see more of?
I'll just mention first, I view this program as a retention issue because recruitment, is difficult and very expensive and long-term, and then you keep losing people. And so retaining people, and at some point someone from research said, patients are just saying, why don't you just come out here and see the patients? I said, well, maybe if I look after your health practitioners, they'll stay and they can see you much better than if you're turning them over and getting new ones all the time. The other thing that sort of is triggered by that is each of the towns I go to is very, very different. Stanthorpe has a lot of health practitioners. Gundawindi is desperately short. And St George is big in some areas and not in others. So the recruitment and retention varies depending on what's going on in town, how far away it is, and involvement of organisations like local government, who I know that the foundation has been really important talking to, that those local governments can help and support a program like this even in small ways. So what you see is where there is community support and local government support and a few other things to attract people and help look after their families, it goes much better. So when the whole community, government, people and other organisations are involved, you get better recruitment and better retention. Where there are struggles in the community or a lack of support from state or local government or a lack of support or understanding from community, all of those things become far more difficult. So it's not so much about the people who are trying to recruit, it's about what's there for the people they are recruiting to help them come and stay.
We've heard that a bit, haven't we, about the community almost have a role to play in the recruitment and retention. I guess what are your thoughts to that, and what can a community do to really help? Yeah,
what are some examples of things you see of?
I had a great story from a friend of mine many years ago. She was at a conference in Canada, and you know how they have all these stalls at the conference thing. Local remote communities had stalls, and they had signs up, and they were getting doctors on their way past and saying, why don't you come to us? And the community would get together and raise funds to own a clinic building or to provide accommodation or to do other things. So the community, as their own initiatives, putting forward things to make recruitment and retention easier, and particularly when you think about families. So it's one thing to get a health professional. their spouse has to be happy.
Yeah,
If
we
they
always
have
say
one.
that if they haven't agreed
So
with the
difficult.
offer, there's no point.
So
like-
get a job for the spouse,
Yes.
or have a spouse who wants them to be live out there. And I've certainly got friends who are only working rurally because their spouse is from a family who's on a property.
Yeah.
And then there's the different ages of kids. You can have little preschoolers anywhere, but once you reach school, and especially once you reach secondary school, you get this moment for a family to decide: do we school locally, do we boarding school, or do we leave? And, family will come first. So thinking about those services, how to support families and engage families and make them part of the community, having sporting clubs and community organisations, whether it's Lions or whoever else it might be, looking after, supporting and involving spouses and kids is really important. And so the community has to initiate that. They have to recognise the need to have the whole family involved in their community, not just to have the doctor or the nurse here and perhaps befriend them, but isolate their family.
Do you think most communities are aware of the importance of having the healthcare professionals there?
Yeah.
Or is it taken for granted?
I think, as John said, every community is different.
Yeah.
And as we've gone out to them, there's some that you go, wow, they totally get this.
Yeah.
They understand that without a health practitioner in their town, they're not going to attract other people to the town. They're not going to build a community, because if you're thinking, do I go rural? You'll be looking at what's the education, what's the health, So before you make a decision to live in a rural community, you look at all of those things. And there's some communities like Quilpie, for example, their council is doing a fabulous job. They're trying to attract people to come and work in their community. And so, for example, at the moment, they provide housing for their council workers because they want to attract people to work for Quilpie Council. So they're looking at ways in which they can make sure that there's support and infrastructure for the people as they come into the community. So you can't underestimate the impact of having a health practitioner in the community, what that does for the financial viability of a community as well.
Yeah, it keeps it thriving.
And we are seeing that there are communities that are really throwing everything at it to make sure they can keep their health practitioners. And we're very conscious, even as a GP, I'm thinking about going out to a rural community, what's the support for me? And so, having a program like ours where they can go, oh, okay, that program's being delivered in that community, I can feel assured that if I go and work in that community, I'm going to have my own healthcare looked after. And we also do see the family members of the GPs, because probably people think, well, a GP can look after their own family, and they do, and they can, but is it the best thing to do? Probably not. And so us being able to see family members of the GPs as well means that, it's not mum or dad.
That's huge, actually.
Sort of looking
Especially
after
with
me.
kids, as they're growing up into teenage years and things too. So the communities then, you were saying you would sit in that community and see any healthcare professional if there was multiple practices or whatever.
Or from the local hospital, or practicing independently away from another practice, local physio.
Yeah. And how do they find you?
Yeah,
Sorry,
I was thinking the exact
you
same
sat
thing.
in the,
Does it take time
a
to drum up
JP
business?
That's where the foundation does a great job for me.
Yeah, we've got an amazing program manager, Coral, and she just hits the phones. Now, Fran, I little bit more money to be able to promote this, to make sure that people are aware that the program is available. And that's what's really exciting about starting to build these partnerships, because it's not just us on our own, spreading the word. There'll be people out there that are going, they're coming next week, have you booked your appointment? And so that's sort of, it is, something that we hope will, continue to grow and build over time. And, we hope that John can have more capacity, and, we're not just in a community for the one day. He's got so many appointments that he has to stay for two. And, it's that sort of thing that we're hoping for.
Have you ever had or tried to go into a community where maybe, there was a bit of protection over we want to do this ourselves, or, you know, we don't need outside help, or a health practitioner who is so used to flying solo and almost
And that was
feels uncomfortable.
Yeah, that was probably something we were very conscious of.
Yeah.
And as John mentioned, you know, we do a scoping visit before we go into a community. So we're not going to go into a community where there is that feeling of, you know, what are you doing? What are you coming into our patch for? But we haven't really encountered that yet.
Yes.
Because do communities seek you out? Because if someone's
Yeah,
listening to this and
that's
we're
right.
sending this out to our client base,
Yep.
can they ring the foundation and say, come
We'd
to
love
us
this here.
if there's an opportunity?
Now you've got
Well, this is your funding
planned,
moment.
or you know,
And
And how do you choose?
we're taking
Yes.
callers.
Yes.
You've got a generous sponsor in mind?
Maybe. I don't know. This is your pitch, right?
Yeah.
And really that's what it's about. You know, we've got the capacity. We've now built a model that we can just replicate. And, you know, we've got all of the training in place. We've got all of the governance structures in place.
And you've got GPs
Yep.
on board to
Yes,
yeah.
we've got, you know, at the moment we've got a number of GPs on board, but we have expressions of interest from lots of GPs.
That's great.
So it's not like the GP treating GP
Yes.
is the issue. It's can we have the funding to deliver this to as many communities as possible. So as you say, if there is anybody out there listening that goes, wow, this is a program that we would love to support, we would love to talk to you, because it's not about what the foundation's doing. It's about making sure that those healthcare professionals are looked after, and ultimately that the rural communities are looked after.
So if there's a rural community listening who think, I really need help, we really need a bit of this type of support, to get them in touch with you, and it may not be obviously immediate, but just to be on your radar that this is
Yeah.
an area that maybe we could focus on in the future.
And you never know what happens. Like I was just chatting to a treating GP that's about to join us. We started chatting about 18 months ago, and she said, I really want to join the program. And I said, I'd really love you to join the program too, but we don't have any, you know, sort of funding at the moment to do that. And obviously with the Western Queensland PHN funding, we've now got that. And, you know, I said to her, remember we started chatting 18 months ago, and now
wonderful.
it's happened. And she's so excited about wanting to, you know, get out there in the communities and deliver this service. And it's exciting for us to have, you know, we've now got a real mix. You know, we've got male GPs. This is our first female GP. And so that's really great as well.
So more funding would mean more of this same program.
More locations.
Yeah, more locations are covered, obviously, then more GPs. Is there other visions that you have for the foundation? Like I know you said you're still pushing the snowball,
Yes.
but I sort of feel like you're not pushing it up a steeper hill. Maybe like is there?
Yeah, and that's sort of, you know, the encouraging thing. You know, there's positive signs.
Yeah.
We're not there yet, but you know, we really want to you know, build on what we've got so far. And so, sorry, just that question you were...
Like, is there, if someone's, you know, listening and thinking, God, I want to donate, but is there other plans for the foundation that you've got? You've got these programs, but is there a big gap that maybe you're seeing clinically, or that you think, gosh, I wish we could fix that?
Yeah, there's so many ways in which this program can grow.
Yeah.
And, you know, you talked before about, you know, not stepping, you know, like were there any resistance or anything like that. And what this has enabled us to do is to build relationships with the health practitioners in the communities. So if they, for example, one vision that I would love to see is that GP could turn around to John and say, hey, look, you know, I want to go and have a month's leave. You know, do you have any capacity to look after my community while I'm gone? Because they now trust John, they know John.
Yes.
And that enables that person to get that rest and that recuperation that they need. Another way of expanding the program is John could be accompanied by a specialist. You know, like if John's finding that there's a real, you know, it could be diabetes, it could be heart disease, what is it that's showing up in this community that, you know, John goes as the GP and then he's accompanied by a specialist. There's the opportunity to expand the program to the community as well. But we wouldn't do that without the support of the local GP.
Yeah, of course.
But the local GP may go, you know what, I'm really swamped right now. John, can you come and hang
And
out
they
with
might
me
have
for
been
a
looking
week?
for a more permanent person that they
Yeah.
can't get. So this
Yeah.
is just additional help.
Yeah. So as I said, like I just love this program, and I just say there are so many ways. It's not just about more communities, but it's about more services and it's more support and that sort of thing. So that might be the first time John's heard that, and he's probably sitting here going, "Oh my gosh!"
I mean, when you see that vision
it's
for you,
when you
it's
see
so
the need.
nice to hear.
If I could touch on what I think we've already mentioned, that disaster relief, and one of the things, and I have nothing to do with that, the foundation does, it's small enough to be really nimble, and Fran described every different practice or practitioner gets help in a way that's what they need. So people might have their own home destroyed or their practice destroyed or both, or they might need particular help with family, and the foundation is small and clever enough to help with that. And I just wanted to touch also on that resistance. I was lucky that I got to go to my town's scoping visits with Coral, which was a chance to engage with heaps of practices in the hospital and just let them know we're coming. And one of the points I tried really hard to make was, if you have an existing health relationship that works, I'm not here to interrupt that. I'm here if you want comprehensive care, because of course we can have telehealth between visits. I'm here if you are already seeing someone but there are some things you want to talk about even on a one-off basis, or if you've got a great relationship and you've got good care, fantastic, and you don't want to see me, that's fine. So there was no resistance to the program. There was a, I don't need it, but there was no one saying this is a bad idea. In fact, a lot of the people said, I don't need it, but it's great that you're doing it.
Yeah.
So I didn't sense on that scoping any resistance. And from the other organisations we visited, like local councils, there was a lot of, I think Coral did a great job of explaining what it is and why, and the benefit to those organisations of retention locally. So they were just starting to get an understanding of what the foundation's trying to do, and that it wasn't somebody else coming sort of delivering a drive-in, drive-out service that was nothing to do with them, that we're actually trying to help them in their community, and they started to get that as well. So hopefully we get a lot more support from those scoping visits. Really important.
How often are you back in a community?
The goal is about every 3 to 4 months, and we're building the schedule depending on the need and the number of people who want to come. So our availability is quarterly, but it does depend. If it's a bit slow on the uptake, then we slow the visits back a little bit. But in between, once I've seen someone with Medicare and with the availability of telehealth now, I can catch up with people in between easily. The only problem really is if they have an acute illness like a sudden sore abdomen, and of course I'm not in town, but at the first visit we talk about what are your options if you need to see someone on a day I'm not here.
Yeah.
A lot of the rest of the time I can be in contact really easily, but if you've got to see someone and examine them, they've got to see somebody. But they've got that problem now.
Yeah.
So that's not a new problem.
That's not new. John, are you seeing a lot of burnout in our health practitioners who are working rurally?
It's lovely to give them a chance to talk about that, because it's masked and it's hidden and you don't understand. And for myself, even when I stopped doing some of my work, I felt my own brain needed to relax and unload somehow for a couple of months, and I hadn't realised. So a lot of people don't realise until they start talking, and they start talking about stress and resilience and struggles and all the pressures that are on them, and it becomes evident to them almost before me that they're at a level of burnout. And the question then is, what do you do about that? And sometimes just understanding and revealing it is the first step, and then making your own decisions about what to do. So yes, there is. So there's the obvious burnout and those who know it, but I think the more people have good care, the more they start to understand their own steps towards burnout, if not there already.
Because they're just not having an opportunity to talk. They're not thinking inward. They're treating other people constantly. And you don't want to burden your partner or your family.
And as Fran said, if you haven't had a break and you've just kept going and going and going.
You don't notice.
Well, it's like the floods you were talking about before. I've got friends who are in Lismore and I've friends who are in Townsville, and your practice is destroyed, your house is destroyed, your family's disrupted, but somehow I'll just keep trying to see the patients and look after the community. I mean, what does that do to one's heart and soul and mind? It's destructive, and yet that's what they do. So any support they get there, but later it's friends in Townsville this last week or two were being triggered just by the rainfall. Whether they were going to be impacted this time didn't matter. They were feeling anxious, and it's almost a bit of PTSD and burnout sort of kicking in when the clouds gather. So better prepared, but emotionally still struggling, and in some ways more terrified.
And all the families, as
Yes,
you said. You know,
all
I think
impacted.
you're right. The doctor goes straight back to work to make sure that they're there for everybody else. But
Yes.
The
Who's picking
family.
up the pieces, and who's
Yeah.
supporting the doctor, who's probably tired and grumpy.
Exhausted.
But it's also the what we've seen a lot of is that, you know, doctors and health practitioners, they're caring people.
Yes.
And so what they often do is they will put the needs of their patients before their own. And I had a classic example. I had a nurse ring me, and it was not this John. We've got two Johns as part of the program. So another one of our treating GPs, John, was already on the road. He'd hit the road, ready to hit the skies, actually. It was a fly-in visit. And she rang me and she said, "Oh, have you got any appointments left?" And I said, "Look, we've got one appointment left." And she said, "Oh, I don't want to take that appointment if there's only one left." And I said, "No, you're exactly the person that needs this appointment, you know." So she said, "Oh, look, you know what? I'm just next door to where John will be doing the practice, so I'll wait and see. And if nobody else takes the appointment, then I'll take it." And as it turned out, you know, she got the appointment, and I spoke to John afterwards, and I said, you know, "How did that go?" And he said, "Oh my gosh," he said, "she so needed to see a GP, and yet she was willing to give up her appointment spot for somebody else in case somebody more deserving, more needing came along." And I thought, that's the sort of people that we're caring for.
Yeah.
You know, people who put others before themselves, and it is, you know, part of this challenge is the education. You know, I think GPs are on the journey of we need to look after ourselves, but nurses and allied health professionals are still not quite there yet, that your health is more important, because if you're not healthy, then you're not there for your patients.
Completely.
So the clinical director of the program is Dr. Margaret Kay, is probably our leading doctor in Queensland about doctors' health, and that's, again, she constantly brings the research and the knowledge and the thoughts about exactly what Fran was just talking about to the program and to myself and John. And no, having the name John was not a selection criteria.
That's what you think.
Pure coincidence. But, you know, that focus on, you know, doctors' health and health practitioner health underpins what we're doing, but the longer term outcome really is community support and community services, and by looking after the doctor's health. So the doctor's health might be the action, but the outcome is community health and community viability.
Absolutely.
It's wonderful.
Fran, is there anything else about the Rural Doctors Foundation that we haven't covered? Is there anything else you're doing or stories you want to share? Or
Yeah. There's probably, you know, a number of stories of the things that we've made possible, and some of them are amazing. Like there's one story of, and it's a bit of a sad story, but there's a doctor that we were given a grant, and we were able to provide. They're called sandpiper bags, but they're a bit like an emergency trauma kit, and so they're set up in such a way that a GP that's trained in emergency medicine can grab the bag and just run and have everything that they need, and it's organised in such a way that if it's a snake bite, all of the snake bite stuff's there. If it's a more critical trauma accident, all of the stuff's there. And we had this beautiful application from a doctor based in WA, and I read his application. I just loved it. It was like one of those ones where, you know, I just seem to attract trouble wherever I go. He said, you know, I was at, you know, the family holiday, and a little kid got, you know, a fishing hook caught in their lip, and had these, you know, range of stories of things that had happened to him along the course. And he said, and I do have my emergency kit, and he said, you know, and I use it quite often because I attract this trouble wherever I go. And so I thought, oh, he's got to get one of these bags. And as it turned out, he, you know, not long after he got the bag, he was travelling out, you know, sort of Northern Territory, WA area, and came across a car accident, and it totally rolled the car. And he was able to stabilise the patient, give them pain relief, actually splintered a leg. And the paramedics were obviously a long way away because they were out the middle of nowhere. And so he was able to do this all before the paramedics arrived, and they just went, oh, wow, this is amazing. But he himself had a tractor accident, and his son was with him, and he said to his son, can you go and get a mate who happened to be, a doctor as well, but grab my sandpiper bag. And, he was able to have his friend use the sandpiper bag on himself. And, it was a very, very serious, accident that he had. But you sort of go, wow, he was able to save the life, or at least alleviate, very serious injuries for these people involved in the car accident. But it ended up helping himself as well. And that's one of my most amazing stories, and probably one of the things that sticks with me most is I remember one of the GPs, it was when I was first, joined the foundation. I said, tell me, what does it mean to be a rural GP? And he said, he said, when you're a doctor in a big hospital in a major centre, or you're working in your practice, if there's something that happens and you're the treating person in emergency or wherever it may be, the first question you ask is, what are the injuries? How far out is the patient? When you're a rural GP, the first question you ask is, who is it? Because you are very, very likely to have a personal relationship with this person. And I hadn't really thought about that before, and I thought, imagine the impact of that. And then another treating GP had told me about the fact that he would caught out to a farm accident, and unfortunately he wasn't able to save the person, and it was his son's best mate. And you go, how do you carry that? How do you cope with that? How do you come home and tell your son his best mate's no longer here?
And the family friends.
So I think there's a lot of, as I mentioned before, there's a lot of weight that rural GPs carry, rural nurses carry, because it's so personal.
Absolutely.
And that's the stuff that's really stuck with me.
But it's also so rewarding and wonderful, and people living in these rural communities love what they do, clearly.
Yes.
So it's just so important that we can support them so they can remain doing
and that's
what they do.
They're so humble, they're so committed, so caring. And, I remember, going to one of my first conferences, and I thought, these health practitioners really know how to party.
They're all from the bush.
But somebody said to me at the time, this is their only opportunity, because, they're the stalwart of their community, so they can't just go down to the local pub and let loose. So, they really are holding their community in their hearts, in their hands. I think it's really, and, that's where I go, people look at doctors and go, they're well paid, they can look after themselves, what's the problem? But you go, my gosh, if you understood the burden that they're carrying, you would have a very, very different perspective.
It's made a lovely point there too, Fran, that little bit of distance and isolation within the community. So yes, you can go and play tennis and you go swimming with the kids or whatever, but if you go to the pub, you don't want to be seen to having more drinks than you should, or you don't, or you maybe shouldn't be laughing out loud so much that people think you're drunk. And there's always that little bit of, no matter who I am or what time of day, I am who I am in this community. And that's just a little thing that makes it just a bit harder to fit in as fully as you might like. And some GPs are great at doing that, but there is always just this little barrier, and also the possibility that there's so few of us in town that if something big happens, I might have to help and be available. So if you're in town, unless you're away at a conference, if you're in town, you kind of
always on.
Almost on, even if you're not on.
Yeah.
Which is where they do need that space, don't they?
Yes, they do.
Those sandpiper bags you mentioned, is that an initiative from the foundation, or is that something that exists? And
it sounds like every...
Yes, so it wasn't an existing initiative, and that's what we try and do. We try and look for things that, what do rural communities need? And so that was a campaign that we really got behind. We at the time of COVID, we really got behind giving all of our rural hospitals and communities access to COVID medihoods, which were a protective device. So a bit like a boy in the bubble type thing, but it went over the hospital bed, and it protected the patients, the nurses, the visitors, the doctors from cross-infection. And once those medihoods were installed in the hospital, the relief of actually there's something between me and the patient to make sure I'm not going to get COVID. And
especially when they're the only one. I think in those times we were probably seeing more of the metropolitan areas and the impact. But if you actually think about that in a community like you're at.
Yeah. And I just was chatting to a doctor on Monday. We'd just given them an ear loop, which is like a device where you can go in and sort of see what's going on in the ear and actually take out, impacted wax. Doesn't sound like a really exciting, product, but he said the difference this has made to our community, the fact that we have this technology, means that they don't have to wait for treatment from the specialist coming into the community, and they don't have to be travelling to the specialist services to get this treatment. So it's things like that we go, what's a piece of equipment that we can provide to rural doctors, rural nurses, that will make their lives so much easier? And something like the ear loop, for example, it's much less painless. So the patients get a better experience as well, and they don't have to wait. They don't have to go through
doing things more regularly and not having to wait for build-up.
Yeah, and if you wait for treatment, sometimes the symptoms get a lot worse.
Exactly.
And that's what we find a lot, John, isn't it? That
it's a lovely thing you've just mentioned. I was chatting with a colleague the other day, and neither of us could think of anything else. There is nothing else we could think of where you could provide immediate and total relief of a symptom than removing an earwax plug.
Really?
Because you go from I can't hear to I can hear painlessly and completely. I mean, if you get a lot of pus out of an infection, you relieve the pain, but there's still some discomfort. If you remove earwax, you've gone from a problem to zero problem by the time the person leaves the room. And so while it sounds simple, impact, it's like, Fred Hollow's fixing people's eyes, a dramatic and complete difference. And if it's an older person, hearing is so critical, and if they're wandering around with this problem and suddenly they can hear, wow, it's an amazing thing to watch someone go, oh, now I can hear.
I can imagine.
Yeah.
What's the cost of that device?
it's only a couple of $1,000s. And,
wow.
And that's the sort of thing that we want to. I think that might be our next project.
Yeah.
We just speaking with that doctor on Monday, and the stuff that's social. Like if you can't hear, you can't socialise.
It's so isolated.
So you
in a community.
become more isolated. So, and he was a lovely, lovely gentleman, very humble, but just chatting with him, you could just, and it's like, with all of the doctors that you talk to, you just get the passion, you're sort of chatting with him, and he starts off really quietly, and then he starts talking about, we did this with this patient, and you can just hear, I just love what I do because I'm making a difference in the lives of people. So it is really beautiful, and I'm blessed to have this opportunity, and I'm to be able to ring somebody and say, that application that you put in, we can help you.
How great.
And in some cases it's a lot of money. In some cases it's not much at all.
Yeah.
But it makes a huge difference. So they're the sorts of things that we're the GPs for Rural Docs is the program that John's a part of. That's our main focus at the moment. But we will continue to look for opportunities for how do we improve the health of people living in our rural and remote communities.
Well, look, today CMR are going to make a donation to the foundation.
Wonderful.
Where do people go if people listening also want to contribute?
Mm-hmm. So our website is rdf.org.au, so fairly simple, easy to find.
Yeah.
There's a big button that says donate.
Good.
So, we've got obviously our crisis appeal running at the moment, and we have our appeal to support the GPs for Rural Docs. But, if people have a particular thing that they're interested in, we'd love to chat to them about it and just say, yep, we're the people that, really want to understand what it is that a rural community needs and how can we make that happen.
I love that it's by asking those questions that you can have the bigger impact versus what you think might be impactful.
And as I said, every community is different. So
Yeah, it's very personalised to that community. Yeah. Thank you so much.
What a pleasure.
How lucky are our healthcare professionals who are getting access to people like you, John, and your other John counterpart.
All the Johns.
Thank you, just for looking after our healthcare professionals. And I think it's just this whole other layer that no one, I think, has that great awareness of, and that impact of the work that you're doing and the whole work that the Foundation's doing when there's crises happen. So thank you both so much.
It's been lovely hearing Fran talking about the Foundation, because I knew it at the beginning when it was small and single purpose, and what it's become in its breadth of thinking about community and what it's become in becoming a national organisation now. Even that surprised me in that short time when I saw this program starting. I thought, wow, look at all this stuff they've been doing from a very small beginning with still a very small team. But I know many of the members of the board, and they're such dedicated people, and there's great innovation and good leadership. So I've been excited listening to Fran's responses today.
Yeah,
Thanks.
I think the Foundation's in good hands. You're doing an incredible job, Fran. What a great few years, and I really hope that people lean in and support the Foundation, because there's so much good that you're doing and that you can continue to do. So thank you for your time.
Thanks so
Been
much.
real pleasure.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.